Hello, I'm Dr. Brant Gibson, and today I want to talk to you about another way that you can test the functioning of the nerves for peripheral neuropathy. And this is called the 2-point sensation test. And basically what it is it's your perception of 2 points that are far apart where you can tell that it's 2 or 1. And as they move closer and closer and closer, can you continue to tell the difference? This is more specific, say, than just a touch or a light touch sensation. It's actually requires some additional ability to sense, so you can actually sense the difference of 2 points, like 2 little metal points that are touching the skin at the same time. You should be able to tell the difference. We typically do this on the big toe because it's the easiest way to do it. We'll do it right on the base of the toe, the tip of the toe, and we actually put them there, and we'll try different distances so that you can actually tell, okay, can I tell the difference when it's 5 millimeters apart, 7 millimeters apart, 20 millimeters apart, whatever. And you're kind of trying to determine at what point you're able to tell the difference. Now, this is a relatively difficult test for a lot of individuals that already know they have peripheral neuropathy, because they have a hard time even feeling touch at all. They're saying, yeah, I can tell you touched me, but that's it. And some individuals even say, look, I never felt the touch. So if you have a severe peripheral neuropathy, you won't feel the touch. So you'll, of course, won't be able to tell the difference between 1 and 2. If you have a little bit less of a neuropathy, you may feel the touch, but not be able to tell the difference between 1 and 2. And then it can go down to the fact where you can actually tell the difference. You can say, I'm getting down to 7 millimeters, 6 millimeters, 5 millimeters, and I can tell the difference. And normal is usually right around 7 millimeters is typically what we're seeing, but some individuals that are more sensitive, that can actually tell more, can sometimes get smaller than that. The other thing that you can sometimes get with peripheral neuropathy is you can get what's called a hypersensitivity, where you're oversensitive, and the touch, the 2-point touch, will be uncomfortable. They'll feel it. They'll say, yeah, that's 2, that's 1, but it's so uncomfortable. That again also shows that you have a peripheral neuropathy, a sensory type peripheral neuropathy. So this is an important test. It's something that should be done. We don't want to just do the monofilament test, which is what a lot of people will do. We want to do monofilament and temperature and sharp dull and 2-point and position sense and reflex and vibration. You want to do all of these tests to evaluate it. And so we'll continue to talk about these tests over the next couple of days to make sure that you know what they are and when they should be used. This is Dr. Brant Gibson, and have a great rest of your, actually, this is Neuropathy Nugget. I guess I better say that. Neuropathy Nugget, day 248. And we talked about 2-point sensation testing as a way to